do I have your permission to use this case study for my kinesiology 6302 course?
Yes.
Do I have permission to videotape this assessment and share it with my course?
Yes.
So Stu is a skier and took a fall in the woods, has some complaints of right knee pain. So we're going to go through an assessment of checking out, first of all, his uninvolved leg, and then going into his involved leg and see orthopedically if there's something that jumps out to us that we want to send him to see a specialist for further imaging, or if it's something we think is more musculoskeletal, we can address with some physical therapy. So Stu, if I can have you just lie back all the way for me if you would. I'm going to check out your uninvolved side first, and we're just going to check for the big stabilizing ligaments in the knee to see how, if they're intact or if there's any concerns that we have with those. So a little hyperextension in the left knee. We're just going to check flexion to see if he has full range of motion in the uninvolved side or where he is about that. Any pain with either of those? So then we're going to check ACL with a Lockman's test. And I get a nice solid end feel there. I'll go into a valgus stress test for MCL, which feels nice and solid, and Barra stress test for FCL, which is nice and solid. Anterior drawer is negative. Posterior drawer, negative for PCL involvement. And then Stu, any tenderness along your joint line here?
So the freedom thing is big.
Anything
Still, if you can't figure out where you want to be, I mean, I think you want to sound like you're really.
So moving over to the involved side.
I can see that. Really enjoy this.
Knowing that he's sort of acute, I'll probably go a little bit easier on some of these tests just so they're not as painful. But they'll be provocative in certain situations, so it may elicit some pain. So again, a little bit of hyperextension into the right knee. Check flexion. Any pain with this? Still okay? Good. And then again, we'll check Lockman's on this right knee. Relax for me if you would, Stu. Relax all the way. Relax. Relax. Nope.
It's very much so.
Good.
And like you just said,
Good.
I've been here 5 years.
Nice solid end feel with that. And then again, we'll go through a valgus stress test. Any pain with that, Stu?
Just maybe with friends and I can meet them.
Any pain there? Okay.
It's just, to me, it's normal. It's just because I work in it.
Any pain with that?
It's just, it's winter.
So I would say positive valgus stress test at 30 degrees, and maybe we'll do some palpation over the MCL. Tenderness there? Let's just check everything else and we'll see. Anterior drawer again, negative. Posterior drawer, nice solid end feel there, negative. And then any tenderness around the knee joint line. Stu.
It does, but you know,
On this side. How about on the inside? Okay. Deeper in there, or does it feel more superficial?
A little deeper.
So we're suspecting a low-grade MCL sprain with Stu. Based on his joint line tenderness, it's unclear as to whether or not there's meniscus involvement, but it's something we would keep in the back of our mind. I have another special test I'm actually going to try. Flip to your stomach for me. So we're going to test the uninvolved side. Any pain with that? And then in that spot where my thumb was, where you were having some pain, is there any pain with this? Pain there? Nothing there? So I'm still thinking low-grade MCL sprain, not overly concerned yet with meniscus, but we're going to monitor it and see how it responds to therapy. Thanks.